Welcome to this video exploring the carnivore diet, a controversial nutritional approach stripped down to its bare essentials. We will examine the science, history, potential risks, and real-world experiences surrounding this meat-only diet. This program is brought to you by the Series of Thoughts team as part of the Health and Wellness Diet and Nutrition series. What exactly is the carnivore diet? It represents a radical departure from conventional nutrition, emphasizing a return to what some proponents describe as an ancient way of eating. At its core, the diet is an elimination-style pattern that removes all plant-based foods. Practitioners consume only animal-derived products, such as meat, fish, eggs, and some dairy, while avoiding vegetables, grains, fruits, nuts, and processed items. The carnivore diet is distinct from ketogenic or paleo diets. It is far more restrictive, as it eliminates the plant kingdom entirely, making it one of the most stringent dietary protocols in use today. The philosophy behind this approach is based on an evolutionary hypothesis that humans are apex predators. Advocates argue that animal foods are more nutrient-dense and bioavailable than plants, which they claim contain anti-nutrients that can cause systemic health issues. While the concept is ancient, the modern carnivore diet has gained significant traction online. This next section explores the history of the practice and its explosion in popularity in the internet age. Historically, populations like the Inuit thrived on diets consisting primarily of animal products. In 1928, Vilhelmer Stephenson conducted a famous clinical experiment, living on meat for a year under medical supervision with no reported adverse outcomes. Between 2018 and 2023, the carnivore diet surged in popularity. Online searches grew by over 700%, and millions joined dedicated communities to share testimonials about their experiences with the diet. Dr. Paul Saladino is a prominent voice in this movement. He popularized the nose-to-tail approach, emphasizing the importance of organ meats. He later evolved his views to include fruit and honey in what he calls an animal-based diet. Judy Cho, a certified nutritional therapy practitioner, takes a different clinical approach. She utilizes the carnivore diet as a diagnostic elimination protocol to help patients identify food triggers for digestive and autoimmune issues. Ortal influential figures include Dr. Sean Baker, who highlighted the diet's potential for athletic performance, and Dr. Jordan Peterson and psychiatrist Dr. Georgia Ede, who discuss its potential impacts on mental health. In this chapter, we look at the potential nutritional benefits reported by the community and supported by various practitioners. Many adopters report rapid weight loss and metabolic improvements. By eliminating carbohydrates, the body may enter deep nutritional ketosis. High protein intake also plays a role by increasing satiety and regulating hunger hormones. Advisors also suggest that the diet reduces chronic systemic inflammation. By removing potential plant-based triggers like oxalates and lectins, as well as processed seed oils, many report relief from joint pain, skin conditions, and fatigue. Finally, the diet is often praised for mental clarity. Reported neurological benefits include reduced brain fog and improved mood stability, which proponents attribute to stable energy levels, efficient ketone fuel for the brain, and decreased neuroinflammation. The carnivore diet has gained a passionate following among those with autoimmune conditions, who report dramatic relief. This is often attributed to the removal of dietary antigens and the healing of intestinal permeability. Practitioners like Judy Cho use this as a diagnostic baseline. By eliminating everything and reintroducing food slowly, individuals can pinpoint their specific dietary triggers for conditions like rheumatoid arthritis or Crohn's disease. Contrary to common belief, animal foods are highly nutrient-dense. Liver acts as a natural multivitamin, while fatty fish provides essential omega-3s, and bone broth supports joint and gut health. However, we must also consider the risks. A balanced assessment of the carnivore diet requires an honest look at potential nutritional deficiencies and medical concerns.
Key concerns include potential vitamin C deficiency, a lack of dietary fiber, electrolyte imbalances, and the complete absence of phytonutrients found in plants.
The impact on the gut microbiome is another significant question mark. The long-term effects of reducing microbial diversity by eliminating plant matter are not yet fully understood by science. Cardiovascular health remains a point of intense debate. While some see elevated LDL cholesterol as a risk, others argue that context, such as particle size and overall inflammation, is more important. Kidney and liver health are also frequently discussed. While healthy organs often adapt to high protein, those with pre-existing conditions or a susceptibility to gout must exercise caution. Beyond physiology, there are practical challenges. Social isolation, high food costs, and the psychological burden of strict restriction are real barriers that affect long-term sustainability. It is important to remember that the carnivore diet is not a one-size-fits-all approach. There is a spectrum of variations available depending on individual goals. From strict, therapeutic versions to more flexible adaptations, your choice should depend on your specific health needs and ability to maintain the diet over time. The nose-to-tail approach, emphasizing diverse organ meats, is often cited as the most nutritionally complete way to practice this diet. Some move toward an animal-based model, which keeps the meat foundation but introduces lower toxicity plant foods like fruit and honey to provide carbohydrates. If you're starting out, remember to prepare for the adaptation phase, track your biomarkers, and prioritize fatty cuts of meat to avoid common pitfalls. Ultimately, while evidence from case studies and personal testimonials is compelling, we must continue to view these experiences alongside emerging clinical research. In 2021, Harvard researchers published the largest survey of carnivore diet adherence to date, involving over 2,000 participants who followed the diet for an average of 14 months. This study provided valuable observational data that challenged common assumptions about the diet's risks.
The survey results were striking. 93% of participants reported improvements in overall health, and 89% noted better weight management. Additionally, a significant majority reported improvements in diabetes outcomes, while 96% reported no significant adverse effects during the study period.
While mainstream medicine remains cautious, the conversation is shifting. Scientists now point to both the lack of long-term randomized trial data and the potential for promising results in treating metabolic syndrome and autoimmune conditions. There is a notable research gap. We currently have plenty of anecdotal evidence and observational data, but we lack the long-term, randomized controlled trials needed to speak with clinical certainty about heart, gut, or oncological outcomes. As we move into our final chapter, it is time to synthesize these findings into a balanced verdict. We will explore who stands to gain the most and who should proceed with significant caution.
The evidence base is most robust for metabolic syndrome and type 2 diabetes, where eliminating carbohydrates reliably improves blood glucose. There is also emerging interest in using the diet for inflammatory conditions and mental health.
Who benefits most? The evidence suggests that individuals with autoimmune conditions, metabolic disorders, or those who have failed other dietary approaches may see the most significant results from a structured elimination protocol. Conversely, individuals with chronic kidney disease, familial hypercholesterolemia, or a history of eating disorders should approach with extreme caution, as the risks of extreme restriction may outweigh the potential rewards.
Ultimately, a fair assessment must acknowledge the gray areas. The carnivore diet is not a universal solution, and approaching it with informed medical consent is the safest path.
Before you start, ask yourself key questions. Do you have a clear goal? Have you checked for contraindications? Are you prepared to track your biomarkers and commit to a structured exit strategy?
Final takeaways. The diet is powerful, but not universal. While the evidence is promising, it remains incomplete. Always aim for the least restrictive diet that successfully meets your specific health goals. For those interested in further study, resources like the Carnivore Code, Judy Cho's The Carnivore Cure, and the Harvard survey led by Leonard's are essential starting points for evidence-informed learning.